overcome disparities in access to care is a legal obligation. Then national health systems are, in the sense, trying to fight and incorporate a better uses of IT, or in this particular sense, of telemedicine. And all those pressures are, in a way, global changes with corresponding consequences that I will talk later on. But in that sense, globalization, and we had an opening a morning address, what does globalization mean? So I refer that in the paper. But here, just for the sake of my presentation, globalization of health is about the process of long-distance exchange of medical services in an informed society. So again, informed society, in that sense, the patients are breaking away from the control of the old system and try to find a better use for a better service for their needs. Now, in the information technology, clearly there are different paradigms that work, different tools that make the IT attractive to the healthcare arena. And these are things that most of us are very well aware of. The internet is changing the way we treat our lives altogether. So medicine is no different than that. Social networks. The M-Health, the new smart cellular communication, is something that is very important, and it will emerge. That's the new thing, because just not for the sake of the argument, just bringing in infrastructure to developing world is very complicated. But once you can turn every simple cell phone to a smartphone, and now we have the technology, every single, most banal a cell phone could be turned into a smart cell phone, that is really changing the way of access and monitoring of patients. And if you want, we can discuss this later on. Clearly, the electronic medical records and databases is something that IT is providing us with huge possibilities. And again, in some countries, this is more prevalent. In Israel, for example, 97% of the medical system is all connected through electronic medical records. In this country, it's between 20 and 30% of primary care. So there is this gap that needs to be leveled, but nevertheless, we will get there. And the later allotments of funds towards that end is clearly changing the face of medicine. And telemedicine, which is clearly the most hype part of this IT revolution, telecare, telemonitoring, professional education. And in that sense, what's really bothering is that most of it was really driven by the industry. So it's a bottom-up kind of a movement, as opposed to what should have been a top-down effort, because of the wonderful promises it can